So I'm going to give you a brief medical history and why I have a central line, why it is so important to me, and why it's my lifeline, and then some things that we can look at and think about moving forward as care providers so that we can take care of patients with central lines to the best of our ability. So I was born 26 years ago with an intestinal malformation of the gut called ileolatresia. Ileolatresia is where the ileum of the intestine is not fully developed. And in my case, it was barely salvageable. So as a 2-day-old baby, I had my first surgery where they salvaged what they could of the ileum, and then they found that the upper part of my intestine, the duodenum and jejunum, were also anatomically and physiologically inadequate. They were very dilated. And for that reason, I could not sustain on a regular oral diet to thrive. And immediately I was put on IV nutrition, or total parenteral nutrition, or acronym is TPN, into a central line, and also enteral nutrition into a feeding tube in the stomach called a gastrostomy tube. From that day forward to today, I've been on TPN, 26 years, and I've had 31 central lines. I'm on my 31st line, and I'm actually wearing my backpack with the TPN in it. And for 20 years, I received the enteral nutrition in the feeding tube 16 hours of the day, every day. With that many central lines and the having what the umbrella term is short bowel syndrome, which is a chronic rare disease and what was subsequently I was diagnosed with after ileolatresia, I've been in and out of the hospital. I've had numerous hospitalizations at 6 different hospitals across the U.S. and 61 surgeries. I've had many infections, bacterial, fungal, over 20 of them. My first infection was as a 3-month-old baby. I had gram-negative rod sepsis. But I'm here today to tell you this story. And unfortunately, I've had many sepsis episodes, but thankfully I've been able to overcome them. Across the U.S., where I've gotten care, in inpatient settings, in outpatient settings, I've seen my line not been taken care of properly, and where my life was compromised. Many times I've seen the hub just been swiped with an alcohol pad. And as a patient advocate, I tell other patients and myself to speak up, and as a hospital organization and as care providers, you do the same. But as a patient, I will tell you, it is difficult. It is hard to speak up, especially in that incident, and it happens so quickly. So I ask you, when you're in the patient's room, are you being mindful or mindful? Right now, today, is your mind full? And I will be honest, I'm here today, there's something else on my mind. That's how we live today. There's always something else occupying our brain. But when it comes to the patient and coming into the patient's room, there is no exception, no excuse. You have to be mindful of the moment and of the actions you are taking to take care of the patient. And so are you understanding the why behind the action of scrubbing the hub, of using the ChloraPrep, of doing that one extra step to save the patient? And so the next slide is a quote by a parent of a 13-year-old TPN-dependent child. It's not my parent, but it illustrates perfectly the purpose of these infection control 101 classes, to really know the purpose behind our protocols. If a caregiver does not understand the gravity and purpose of their care with infection prevention, they will not be as compliant or effective. When a caregiver is scrubbing the hub because that's the rule and not thinking about the child's lifeline and how to protect their bloodstream from infection at every access point of anything that will be going into the line, body, then there will be an increase in errors. And I completely agree. So my line is my lifeline, and it's very important to me. If you want to go back one slide. I've included this picture to illustrate how important it is. 2 years ago, I had an intestinal transplant, and for the first time, I have a full functioning small intestine. And I've achieved milestones I've only dreamed of, and my health is much better because of it. But one of the things that happened is I got off the TPN, but unfortunately, I lost 20 pounds in 6 months because the gut was not ready and we needed more time to adapt. Only because of the TPN and proper care was I able to gain the weight back. And this is showing you that in 6 months, I lost 20 pounds down to 95 pounds and then got it back with the help of TPN. And this TPN, my entire life, has not only let me be able to live and survive, but really live with a quality of life. And growing up, I wasn't afraid of the dark or monsters under the bed. I woke up being scared of IV line infections because an IV line infection really stops your life. I mean, you could wake up feeling fine, and then in the middle of the day, you get the high fevers, the uncontrollable shakes, and you know immediately, gotta go get blood cultures, anaerobic, aerobic, and head to the hospital. And I could be there for a week at a time, getting all checkups, and then most likely the line will have to come out, and then another surgery to put another line in, and I miss another day of school. I've missed many school events because of line infections. So our purpose is we take so much care and put in so much hard work to protect the line. So 2 slides, one more, there we go. So what are some things that we can think about to take care of the line properly? So of course, hand washing, gloves, masks. I was at a hospital and I was after the transplant, and I had a complication I developed the fungal infection aspergillus. And thankfully, the aspergillus was only found in the lung, and so the treatment was to have lung surgery to take out the nodule in the lung and then get on an antifungal. After surgery, the surgery went well. After surgery, I was put on the lung floor instead of a surgery or a transplant floor. And I was in a lot of pain, if you can imagine, lung surgery, and I was on a PCA pump, and I was kind of out of it, but I was trying to be as alert as possible, especially when care providers are in the room. And I was on TPN at the time, and the nurse had come in for the night to hook up the TPN, and she came to my line and had no gloves on. And as I said before, it's a very awkward position or hard to speak up, especially when as a patient you're pretty much bedridden and not as alert because you're on pain medication, and it's only up to you to be your own patient advocate. Thinking that this nurse maybe had no experience with central lines, being on a lung floor, and does not see patients with these kind of situations. So I came at it from a different angle, and I said, "Are you familiar with central lines? Do you see patients on a regular basis with central lines?" And she said, "Oh yeah, of course, I see them all the time, and I've been a nurse for X number of years, and so I have seen this many central lines." I said, "Well, then you know that you should be wearing gloves right now." And she immediately said, "But I washed my hands." That's great. That's one thing off the checklist. But where have her hands been? You watched the video at the beginning. There is no sink in the room, and I don't know if she washed her hands before coming in. And then she didn't even put clean gloves on before she touched me. It is those incidents that we want to prevent. And then masks. So right now I only get home health care to draw labs. Other than that, I do all my own care. And I've advocated to my own home health nurse to wear a mask, even just for drawing labs. So I have a rapport with my nurse, and we love to talk while she's doing care. It's almost 20 minutes. But for her to put a mask on, both of us, while we're talking, it prevents airborne contamination. And I hope you have the same rapport with your patients when you're giving care, but you're conscious of the fact that you're touching their lines and you're talking, breathing. Contamination can occur through airborne and touch. Scrub the hub. When I'm scrubbing the hub with an alcohol pad, there's grease coming out of my elbows and steam coming out of my ears. I do it with purpose, and that is what we want you to do. And we'll talk more about the exact mechanism of scrubbing the hub. And then Lines Up, Tubes Down is a campaign done by UCLA. It's explaining that keep your central lines and IV tubes away from gastric drains, ostomies, and JP drains and similar tubes. I have an ostomy, and it is so important that I separate my care of my line with the care of my ostomy, and that I wear gloves for both. As an inpatient, because we are so bedridden and attached to the IV pole, attached to the wall, I appreciate when nurses take effort to help me pin up my line away from my ostomy, because we have a gown on, we're not wearing our normal clothes, we're not familiar with the environment. We need you to help us become part of your world and figure out how can we keep our line safe. Use for only PN medication. I fortunately have not been victim to this, but I've seen fellow patients been in a position where care providers have wanted to use the line for a non-parenteral medication. Very dangerous. And then I included mechanical errors. So I've had 2 incidents where in the hospital my line has been broken because nurses and caregivers were not being mindful in that moment. There was a nurse was just flushing it, taking off the TPN in the morning, just like any other morning, but this time transport was outside waiting to take me down to radiology. How many of you have been in a position where you're in a hurry trying to unhook IVs and tubes so that transport can take them? She was just in that instance flushed too hard and it burst. But I had already educated her that my line is this number of years. It cannot handle the normal pressure of just one swipe, like a fresh line, and to be very cautious when you flush. But in that moment, she was in a hurry, more concentrated on the fact that I need to go to radiology, and so she went too fast and the line burst. And that's happened more than once. So please be in tune to the patient and ask, does your line have any special care due to X, Y, and Z? Because mechanical errors can provide for infection. Scrubbing the hub, contact time 15 seconds. For me, my care of the line, scrubbing the hub, putting my TPN together, changing the dressing, all of it is normal for me because I've done it for 26 years every day. It's automatic. We want that for you. So just automatically think 15 seconds, to automatically think of having that grease and friction when you're rubbing the alcohol on the cap, to let it be your norm. Or dry time, and then minimization of contamination. That's a good tongue twister. And this is an image to emphasize the importance of scrubbing the hub. We put the germ on the cap, and then they put it under the light to take the picture at 0, 5, 10, and 15, and you can see clearly at 15 versus 0 that the germs are gone. And this is the last slide. It's a campaign done by the organizations on the bottom. I'm an ambassador for Oli Foundation, which is a support group for those who have feeding tubes and central lines. And it is the acronym SAVE, Scrupulous Hand Hygiene, which is saying wash your hands between patients, before putting gloves on, after taking gloves off, before you're touching the patient. Let's say you put gloves on, but then you go to the pump to change the infusion, then you go to the patient to connect the line. Those gloves are contaminated. Be conscious of that. Put clean gloves on, go directly to the patient. I've seen that many times in my own case. Aseptic technique is just always scrubbing the hub with the proper 15 seconds friction, and not to reuse products. I've seen just recently, actually, an alcohol pad be reused. I have a double lumen catheter. The alcohol pad was reused for both lumens. I've had syringes maybe fall on the bed or swipe accidentally on a clothing or something, and they still put it onto the hub. Vein preservation, protect our veins. Our veins are limited, and so protect them by avoiding infection, and then ensure patency, which is what I'm talking about. If there's any resistance, but you still flush, and then it could blow. So any resistance, don't try to push through.